Hello.
Hi.
How are you doing today?
Good. How are you?
Good. My name is Jennifer. I'm going to be your nurse today.
Okay.
And I have a student with me. Her name is Flor. So we're going to just be administering some medications and we'll be doing some teachings at the same time, okay?
Okay.
So just give me a second, but I'm just going to check your wristband first. Can you tell me your first and last name?
Sure. It's Levi Restivo. I'm 67 years old.
Okay. And do you have any allergies?
Yes, I'm allergic to tetracycline and dog hair and peanuts.
Okay. And what kind of reactions do you get to them?
Anaphylaxis reaction to the tetracycline and the peanuts and the dog hair. I have trouble breathing.
Okay. All right. So just give me a second. I'll be back to give you some meds, okay?
Thank you.
So that's the first thing that I like to do is just come into the room. I like to check that, make sure I have the right patient. I checked his two identifiers and his allergies. So I'm going to go into his chart and I'm going to check that it says Levi Restivo, 67-year-old male, and that he's allergic to tetracycline, dog hair, and peanuts, and he has anaphylactic reactions to the tetracycline and the peanuts, and he's short of breath with the dog hair.
Okay.
Okay, so is there anything that you need from me before?
Yes. Do you mind giving me an SBAR report, please?
Yes. Okay, so this is Mr. Levi Restivo. He is a 67-year-old male. He is in room 620. His doctor is Dr. Phillips. He is a full code, no isolation. Like we went over, he's allergic to tetracycline and peanuts. He gets anaphylactic reactions for those. And for dog hair, he has difficulty breathing.
Okay.
So he came in because he had complaints of some pain in his right toe. He also has been having blood glucose levels in the 300s for the last 5 days. It's a little dangerous, so we want to take care of that. So he is a type 2 diabetic, insulin dependent, has been for the last 20 years. So after we've assessed his ulcer, we came down that it's a stage 2 diabetic ulcer on the right heel. He does have a history of hypertension, diabetes. He is alert and oriented ×4. So I assessed his pain earlier. He was at a 6. We gave him some morphine. So I asked him again, a little bit ago. He's at a 1 now. He's slightly anxious. He has a steady gait. He does have some lower bilateral tremorly tingling. That could be due to the ulcer. Let's see. When I assessed him, his Perla, EOM, everything was fine. He does wear glasses though. I auscultated his lungs. Everything was clear, unlabored. He's on 96% O2 sat on room air. We did an X-ray chest for rod infection because we are going to be giving him vancomycin, but it came out clear. His heart sounds were normal. S1, S2, his apical was regular. His pulses were 2+, so they were nice and strong, no murmurs. His cap refills were less than 3 seconds. And we will be doing his vital signs every 8 hours.
Okay.
Okay, for his GI area, all 4 quadrants were active. Flat abdomen, non-tender, soft. He is on an 1,800 caloric diet, 2 gram restrictions per day. He has not been compliant with his dietary needs, so we will be giving him some pamphlets and stuff to address that. And he's voiding normal, no Foley. He has Gilles drawn urine. We're doing eyes and nose every shift. So right now he's just at 620 milliliters. We do have orders for dressing changes, and we're waiting on a wound consult. His temperature, his vital signs, about 15 minutes ago, his temperature was at 100.1, so it's a little elevated, but that could be due to the infection. Heart rate 76, his O2 sats 96, like I said, and his blood pressure is 132/70, so that's why we'll be giving the lisinopril. And his blood glucose 15 minutes ago was 290, so we'll be giving him some insulin as well. And his white blood count was 195, so that's also for the Vanco.
Okay.
Okay. So is there anything else that you want to ask me? Before?
Not at the moment. Just whenever you give the medication, I'll have some questions for you.
All right, perfect. So I'm gonna go into this chart real quick. Okay, so I am in his chart, and I'm gonna go to his MAR. Okay, so we're gonna start with the lisinopril. So let me just find it. Okay. So again, I'm gonna come over here and I'm gonna ask him. Can you please repeat your first and last name?
It's Levi Restivo. I'm 67 years old.
Okay, and your allergies?
I have allergies to tetracycline, dog hair, and peanuts.
Okay. So I'm going to go over the system and grab his medication. I am going to verify on the computer that he is indeed Levi Restivo, 67, and his allergies. While I'm pulling this out, I'm going to verify, I'm going to do my 5 rights. So I just want to make sure I have the right medication and compare it to the MAR. I have the lisinopril. The dose is 10 milligrams per tablet. Right here it says 10 milligrams per tablet. The route is oral. This is the pill. It's the right time of the day. Right here it says 1700, and I have my right patient. You also want to check the expiration dates. You know, you really won't ever come across it, but you always just want to come, you know, just in case.
Okay.
Okay, so I'm going to go in here. Okay, and I'm going to read his patient ID number. Okay, and then I'm going to do his medication code. Okay, so I have a green light. Thank you, camera person. Okay, so because this is a PO, I do want to verify first that my patient is able to take this drug in this route.
Okay.
It's already checked in the charts. He has no problem swallowing pills. But you want to ask the patient, Mr. Estivo, do you have any issues swallowing at the moment? Mr. Estivo,
Oh, I'm sorry. What was the question?
do you have any problems swallowing at the moment?
No,
Okay. Thank you. You're dozing off on me over there.
I'm sorry.
That's okay.
I think it's the morphine.
Maybe it could be. Okay.
Just make sure you check my breathing.
Okay. Okay. So I'm just gonna check one more time once I'm preparing. I have
Sorry,
my.
I'm very good at like blocking out my wife. I must have thought.
It's okay. I'm so gonna verify again. It's lisinopril, 10 milligrams. Frequency, I'm giving it one time today, Tuesday at 1700. And I'm gonna verify. I'm gonna put the time here. But you're never gonna actually save or anything until after you administer the medication, just in case the patient decides to refuse it, and they have that option. So I'm gonna put here PO. Okay. 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 So here's your lisinopril, and there is your water. Thank you. Do you have any questions for me about the drug?
I do. Why is the client receiving this medication?
The client is receiving this medication because he has high blood pressure. So we took his blood pressure about 15 minutes ago, and it was 132/70. So that's not a normal parameter that we want to be in. So we want to give him some medication to drop that.
Okay. What action does this medication have on the body?
So the lisinopril is an ACE inhibitor. So what it does, it inhibits the conversion of angiotensin 1 to angiotensin 2, which is a vasoconstrictor. So when you constrict the vessel, the heart has to work harder to pump the blood out. So since it inhibits that, it's going to not really let them relax, but it just won't do the constriction at all, which will allow the resistance will decrease and the blood pressure will hopefully go down.
Okay, and when should you question administering this medication?
Like I said, we always do want to do the blood pressure. So normal blood pressure is 120/80. So if it was in that range or if it was too low, I would not want to give the medication because I don't want to bottom out the patient.
Okay. Does this medication have a therapeutic serum level?
This medication does not.
Okay. Which vital signs must be monitored?
With this one, you want to monitor the blood pressure.
Okay. And what interventions must be taught to the client in the hospital setting and at home?
Okay. In a hospital setting, we'll be taking care of most of all the work. We'll be doing his blood pressure and stuff. But we also do want to teach him while he's here at the hospital, so he can take these habits home with him, to check his blood pressure before he takes the medication. Make sure he takes it at the same time every day, even if he does feel okay. To not skip any of his doses. That's all I can think of right
Okay.
now.
And what are the side effects and potential adverse reactions?
Some adverse reactions for lisinopril. He could have angioedema. He can have hyperkalemia, hypotension. So I'm gonna instruct him to, if he has to get up from the bed, he has to go to the bathroom or anything such as breathless call light. So I can come help him. So I'll make sure we don't cause any falls and coughing and dizziness.
Okay. And how will you know the medication is effective?
If his blood pressure goes down.
Okay.
So, and Mr. Restivo, I just want to let you know that we will be doing some teaching while we're giving this medication. So for lisinopril, I'm going to give you 2 side effects that I want you to look out for, and I'll be asking you again a little bit later.
Okay.
So I'm going to tell you now that a dry cough and a headache is going to be your side effects to remember for lisinopril.
Okay.
Okay? All right. So I'm just going to finish here documenting. Let's see. Okay. Alright, so I'm going to wash my hand after that one. Okay, so the next one that we will be giving is the insulin.
Okay.
Okay, so let me just grab my tools. Is there any questions that you want to ask me about insulin?
Yes. Why is the client receiving this medication?
Client is receiving insulin because he is a type 2 diabetic, so he is insulin dependent, but he does have a glucose level right now of 290, so we want to drop down his glucose level.
What action does the medication have on the body?
So insulin is it's like a locking key, right? So you have your cell, and the insulin binds to the receptors on the cells and opens up a channel for the glucose to go into the cell, and then the cell will use it as energy, and then because the sugar goes into the cell, it's going to lower in the blood.
Okay. When should you question administering this medication?
If this patient's blood glucose level was normal for, if it was 70 to 110, or if it was too low, you're not going to want to give that to him.
Okay. Does this medication have a therapeutic serum level?
This one does not.
Which vital sign must we monitor?
You want to monitor his blood glucose levels.
Okay. What interventions must be taught to the client?
The client that I want to teach him, and I'll tell you here while we're at it, is that when you are at home and in a hospital setting, you always want to rotate your sites because you end up developing like a little fatty patch if you keep going into the same site, so you always want to rotate. You always want to use an insulin syringe. You don't want to use any other kind of syringe, and you want to check your blood glucose before you eat, and always make sure that you have a meal, or you're going to have a meal within 30 minutes. So we're going to administer your insulin because you have your food tray ready, but yeah, that is very, very important.
Okay. Are there any side effects or potential adverse reactions?
The first one that comes to mind always should be hypoglycemia. That's why I told you it's really important for you to eat 30 minutes after because they can start having heart palpitations, confusion, cold, clammy skin, or they can become hungry. So those are going to be signs and symptoms that I'm going to have you remember. So you'll remember hypoglycemia. You'll have cold and clammy skin. So if you're dizzy or confused. Okay?
Okay. How will you know this medication is effective?
We'll check his blood glucose in a little bit and make sure that it went down.
Okay.
That's all for now?
Yeah.
Okay.
Thank you.
No problem. So I'm going to wash my hands, and I'm going to ask you to tell me your first and last name, please.
It is Levi Restivo. I'm 67 years old.
And your allergies.
Tetracycline, dog hair, and peanuts.
Okay. And so I'm going to verify my drug again. I want to make sure I have my regular lisinopril. Not lisinopril, sorry, insulin. My regular insulin. I'm going to make sure the expiration date is good.
During your shift, what do you look out for? Patients getting breath. No, that's the side effect.
Alright, hold on one second.
It's not complication, it's situation. You already have another one.
Okay, so just want to check it against the MAR. I'm also going to check the patient's first and last name and allergies against the MAR. So I see it's going to be subcutaneous for the route, 1700 for the time, my person, my medication, and my dose are all correct. So this is a sliding scale insulin. So because the patient is at 290, we'll be administering 16 units of insulin. And one thing that I didn't tell you about the lisinopril, it kind of slipped my mind, that I will tell you with the insulin, is if you ever need any of your meds crushed, mixed, or anything like that, you always want to call the pharmacy, or if you have any questions at all, you can just call the pharmacy or verify with the doctor, or you also have an online guide that can also help you out with that.
Okay.
Okay? No problem. So, wash my hands. You can never wash your hands too much. Okay, so I'm gonna wear my gloves.
One at a time. So you have what?
You can never wash your hands too many times, and you can never check your medications too many times. So I'm going to check this again. My insulin expiration date is fine.
Yeah, but
Good. So first thing you want to do is clean the top,
so the first one.
Okay.
because these aren't single dose medications.
Okay.
So you always just want to make sure it's nice and clean.
Okay.
Okay. Okay, and you're going to grab your insulin syringe. And the first thing I'm going to do is I'm going to inject 16 units of air. And then I'll have you verify that this is 16 units.
Okay.
Okay, so you want to be very careful not to bend the needle. So I'll insert the air. And then I'll bring this up here. Okay. Make sure there's no bubbles in your needle. Okay, so you want to verify 16 units?
Yes, this is 16.
16? Okay. And you never want to recap with your hand. So you'll always want to do the scoop method if it allows you. Okay. And then we'll just check the more one more time for your insulin. Okay. So I'm going to grab my swab. I'm also going to ask my patient, actually before I do this, I'm just getting ahead of myself here.
You can't use the, yes, but if you say the pathophysic, you just did, that would.
So decrease cardiac output.
No, what did she just do?
Okay.
Ineffective for perfusion,
Decrease
why?
oxygen to the tissue.
Because what?
Because
Yes, you need to state somewhere around, the related to is,
there's vasoconstriction.
what happens, think about what happens in diabetes.
Okay, so I have my green light if you'd like to verify these.
Why do people have?
Mr. Restivo, where did you get your last insulin shot?
The left lower quadrant.
Okay, so we're going to do the right upper quadrant this time. Is that okay?
Okay.
Okay. We're going to put in the time. We're going to put, this is going to be a sub-Q injection. We're going to do the, we said the right upper quadrant.
Relate to after.
Right upper quadrant for administration, 16 units, because his glucose level was at 290.
Okay.
But we're not going to save this just yet. I'm going to come over here to our patient.
Okay.
So we're going to clean it really, really well. Let it air out a little bit. Okay, we're just going to do this in a 90-degree angle.
I know, I do too. Okay.
Good.
And you never, never recap. I'm going to put it over here in my sharps container.
So what are you gonna do?
Okay.
What did you go into? You went to the patient, what?
So was there any information that you reviewed before administering the medication?
Yes, you always want to review your allergies with any medication you give. You know, you have a busy day, so you might forget, so you always want to review allergies. In his blood glucose level, just wanted to make sure that he was in the parameter to give how much insulin I gave and to give him insulin.
Oh, so did this information affect your decision to give the medication?
It did, because his blood glucose was 290, so he did need the insulin, so I went ahead and gave it.
So did this information affect how you administered the medication?
Nope, I still would have given it sub-Q.
Okay.
Okay. Alright, so I'm just going to verify here that sub-Q, ready for quadrant replacement, 16 units of insulin, and blood glucose was 290. So I'm going to put my initials and I'm going to save.
So the vital signs are important as well. That wound for what?
Necrotic tissue, drainage,
So you're gonna
like
catch
purulent, or
Yeah.
Okay, so the next thing that we're going to give is a vancomycin. Before we do questions for that, I'm just going to set up the primary line first because it is a piggyback, so you have to have a primary line first. Okay. So the order for his primary line is going to be
This is the evidence that I use.
0.9% normal saline.
Okay.
Okay. And it's going to be continuous for 30 milliliters per hour. And we'll be using the Diloflow.
Okay.
So I'm just going to come over here and again ask the patient, can I please have your first and last name?
Yes, it's Levi from Steve-O. I'm 67, and my allergies are tetracycline, dog hair, and peanuts.
All right, thank you. Okay, so I'm going to come here and verify the more that I have received Levi 67 and his allergies. And I'm also verifying that I'm giving him sodium chloride. So I'm going to come over here. So before we put anything in his IV, we're going to want to flush it, but we also want to check placement too.
Okay.
But when I first get my bag, I want to look at my bag, make sure that there's not any holes or any tears or anything, make sure that the expiration date is on there and to see that there's clarity and that everything looks okay with the normal saline. And it does right now.
Okay.
So I'm going to verify this right now. So sodium chloride, 30 milliliters per hour, and the expiration date for dose my patient. We're giving it at the right time at 1700. So first I'm going to insert my patient's ID here. Okay, and the medication we'll be giving him. Okay, so I have a green light. Can I please? Alright, so here's my green light for my sodium chloride.
I know I didn't forget anything on this video.
So the site that we're going to be giving it is in the right medium forearm.
Okay.
That's where his IV is. So before I do that, I am
Supposed to look at it before.
going to put on my gloves and I'm going to set up my lines.
We went over in class.
Okay, just want to make sure that they're back there. You don't always have to wear gloves. I like to wear gloves all the time. It just depends on the person.
I know it's somewhere.
Okay, me too.
Your diagnosis, your potential complications.
And another thing that we always need to label. I'm trying to get my primary line. Okay. And primary lines are good for 72 hours for 3 days. So I'm going to label my first one to be changed on Thursday.
Okay.
The 13th. and 1,700 by me.
What could
Just wanna
happen to
make
that?
that there. I'm gonna take out my tubing, and first thing you're always gonna do is clamp it. I was gonna say lock it, but it's clamping. Okay.
Not just because of that,
This
but the fact that
one.
he's diabetic, right?
See, actually, I'm gonna grab other tubing. This one doesn't have a cap on it. Give me this one. Just gonna grab these ones instead.
Good. Diagnosis?
I'm just gonna take off all this stuff. I miss the trash can every time. Okay. I'm gonna clamp.
Interventions? DMT?
And I'm gonna label my tubing.
What, you want D first. What are you gonna do when you go in? How about assessment? What are you going to do for me?
Okay. So one thing I want to tell you about this tubing is both ends are sterile. This end and this end are sterile, so you don't want to ever touch it with anything. So when we do end up connecting this, we'll actually connect this to a dial-flow, but if you were to connect this to the patient, it would have to be sterile, so you'd have to clean the hub first.
Okay.
So again, I'm just going to check again my MAR, or my sodium chloride,
Monitoring.
30 mils.
Monitoring is assessing. So what do you
Okay.
assess?
Okay, so I'm going to try not to spill
Good.
this.
Good. More importantly, we're talking about impaired skin integrity.
Okay.
Monitor
It's
the
really
size
sharp,
of
so be
signs
careful and make sure that you put it
such
in the right way, because you could just poke a hole.
Right.
So because this is already clamped, it's not really going to go anywhere, because I want to get my dial-flow ready first. But I am going to fill the chamber about halfway,
Come on.
so my priming will start when I'm ready with my dial-flow.
Okay.
Usually in the morning and
Okay,
before
so
we-
I'm going to grab my dial-flow, and if I can find it. Okay, and I'm going to set it to open, which is right here. Oh, I think
Nope, now we're gonna do teaching. Teaching,
okay.
How to wear comfortable shoes.
Okay, this is open.
Well, they also need.
And I'm just gonna grab this.
Medication list. I think he wasn't taking this necessarily, more so teaching how to med. Yeah. True.
Okay.
during your
Well,
shift,
you need to check it.
I don't
It's
want
like,
to get that there.
not during your shift right now. You just came your first day.
Keep the dressing clean and dry, not get it wet.
That sounds good to me. That sounds like a great.
Because he has the bad sensation, he can't feel it, so he needs to look and see.
With the side.
And what will help promote
Okay.
that?
If I can get this open.
What else?
Not elevating, that's gonna impair.
Motion.
Okay.
Motion.
So I'm gonna prime this first so it is open.
Mobility. Right. So teach
So
him
I'm gonna-
to use the
I
dressing.
can prime this a little bit so you can see them unlock here. And
Clean, dry, and intact.
prime my line and make sure I don't have any air bubbles
And increase.
at all.
Where you can do active range of motion. Teach him active range of motion. And, importance of FCD.
Now I have a couple left. Okay. And do you want to be an assistant real quick and just
You can't
hold
because
this
you just
and
went through all the other stuff.
to make sure it doesn't touch anything?
What other?
So I'm just gonna apply these gloves. And so the next thing I'm gonna do is I am going to flush the patient's
Okay.
site. The reasons I would flush, again, I think I told you, is for placement. So we are going to aspirate, and if blood comes back, then we know that we're in a
What else?
leak.
Okay.
What was the other one we had?
I can put these gloves on. These aren't the best
It's
of
the same thing,
gloves.
you just put it towards impaired skin integrity, which instead of it, you're talking about the same thing.
Okay. I'm gonna grab my alcohol swab, and I'm gonna grab my normal saline. But I am going to put this down first and
That's why I like doing oral.
clean the site
Whenever I review my students' care plans,
for about
I
15
do it like
seconds
this.
and
They have to give
just
me,
make sure it dries off.
like a lawyer, you have to give me your case. Does that make sense to you? You know, or explain to me this, if it doesn't make sense to me. But if you can explain it,
So
something
you're
like,
gonna
oh,
aspirate,
that
and there's some blood. We're just gonna push it through. Are you having any pain at all?
No, it's just cold.
Just cold? All right. Okay.
Good job.
Wait, when we do our final video,
Okay. And thank you. We're just gonna clean
No,
this
I-
one more time right before we put in that
Yes.
dilafol line.
Most of the time, during the regular semesters, fall and spring,
Clean it nice and well.
I don't have this many students, I only have like 25.
Okay.
So, but with 50 of you in different rooms, I can't really watch you. But
Okay, so
When I have
once we have
25,
it
I make sure
in,
they have it.
I'm not gonna change it from open to 30
center church, that too. Yeah. All that, the directions are all in the Dropbox.
to 30. So it's
Okay.
gonna start, and I'm going to want to unclamp so it'll actually start going.
people were saying that every clarification.
You feeling okay?
Mm-hmm.
Okay.
Yeah, it's better that way because if you pull the all one, the IV is and now,
As long as you have it, because then they were like, this doesn't have
So I'm gonna put here,
I was like, why am I waiting?
alright, just verify it's 30 milliliters per hour, continuous, the time, I am putting for 17.
probably not, I just heard from.
IV site, right median, forearm with a flush, and we'll document the flush later.
Okay.
Okay, and last but not least, we are going to grab our vancomycin. So I'm just gonna go ahead and check. Can you please tell me your first and last name and your date of birth?
Levi or Stevo, I'm 67 years old.
And your allergies?
Tetracycline, peanuts and vodka.
Perfect. And I'm gonna go over
But,
here and grab
I need someone to take
vancomycin.
So why is the client receiving this medication?
Okay, hold on just 1 second, sorry.
Oh, okay.
So I'm just gonna check here that it is the right patient, the allergies, and I'm also just verifying that this is the vancomycin. So I just wanna compare it to the MAR real quick. So I have my vancomycin. We're gonna be giving it over 2 hours, so it's 1,500 milligrams of 250 milliliters. So it's gonna come out to 125 per hour because the dilaflow is per hour.
Okay.
Okay, so now that I have checked it, let me just put this in and I'll answer your questions
Oh
in
yeah,
just a
no
second.
problem.
Thank you.
Oh my god.
Okay, and I have a green light. Beautiful. Thank you, camera person. All right, now I'm ready for your questions.
Okay. Why is this client receiving this medication?
The client is receiving. receiving vancomycin because his white blood count was at 195, so there's a suspect of infection.
You
Okay.
guys just left your people?
What action does the medication have on the body?
Well, this medication is a broad spectrum antibiotic, so it inhibits bacterial growth by destroying the cell wall of these bacteria, so they can't keep growing.
When should you question administering the medication?
I would question giving this medication if their white blood count was normal.
You want me to tell them that? How they gonna get
Also,
it?
if they have a temperature, is also one of the side effects of having an infection. So,
Just wait
but
for them.
I would check those two. So if they didn't have either of those two, I wouldn't give it.
Okay, does the medication have a therapeutic serum level?
It does have a therapeutic serum level. Let's turn this over here. So you would want to do a peak and trough for this medication because it does have a toxic level. So anywhere that would be 80 to 100, you would want to.
Okay, which vital signs must be monitored?
The vital signs that you would monitor, I mean, you can do the temperature. You'll do the temperature to make sure the temperature is high, and also the white blood count. So any labs that you would have done.
Okay, what interventions must be thought to decline?
Any intervention that the patient should be taught is any side effects of this medication. So if the patient starts, they have like any hearing loss or if they have any flushing, which is called red man syndrome, which I'll teach now to the patient, Mr. Estivo. So the two side effects for this medication is if you're having any flushing at all, and if you have any hearing loss.
Okay.
Okay? All right.
Okay. And how would you know this medication is effective?
We'll know this medication's effective if we do his white blood cell labs again, and if they went down, then we'll know it's working. Also, if his temperature starts decreasing, we'll know that it's working as well.
Okay.
Okay, and then again, with this medication, if you need to question the dose or anything like that, you can just call your pharmacist or use your online drug guide. It'll be able to help you with that too.
Okay.
Okay?
Thank you.
No problem. So I'm just going to put here the time that we're administering this medication, 1700. Okay, so I'm just going to wash my hands and I'm going to grab my secondary tubing. And this is going to go through an IV, and so we've already started that.
Okay.
So we're good to go.
Your diagnosis.
So I have my secondary line here. And with secondary lines, you're going to want to put them higher than the primary line. And that's how we're going to prime it as well.
Okay.
And because we also stated that this is going to have to go over 2 hours, so each hour is going to be 125 milliliters of medication.
Okay.
Remember, we want to...
125 mLs an hour?
Yeah, sorry.
Okay, yeah.
And you want to clamp. I can't remember to say clamping. Okay. Okay, so I also want to verify that this has to be changed within 24 hours. So this is going to be for tomorrow at 1700, Tuesday, and by me.
Leaving from the building?
Okay. Okay, so again, I want to check my medication again, just to make sure it's vancomycin over 2 hours, the dose, which is 1500 over 250 milliliters. Okay, so again, this is sterile, so we want to keep both of them nice and clean. I'll pull this one out first. And then I'll pull this over.
Okay.
We're going to connect. Okay, so we're already clamped, so this isn't going to go anywhere. So one thing, we're going to grab another alcohol wipe, and I'm just going to grab some gloves again. We'll be connecting it to this port.
Okay.
Here, okay? Okay. I'm gonna grab this, and I'm gonna grab my alcohol wipe. And I'm gonna move this down first. Put that there. And I'm gonna grab And just leave this here. Just let that dry. Once it's dried, we're just gonna connect it. Okay. And
Well,
we're
for some
going
of us.
to unclamp. See the air is starting to come up, and it's gonna fill about halfway. And once it fills about halfway, we can clamp. Because I have to change the dial flow
Okay.
to the correct drops. So I'm gonna change my dial flow to 125 drops per minute. And then I'm going to come check in periodically to make sure that I'm going to change it to the 30 minutes. If not, it'll start doing 125
Okay.
for the primary one. So once that's set, I am going to unclamp this. You can start going. And everything looks good. I don't think I'm missing anything. Do you have any other questions for me?
Yeah, was there any pieces of information you reviewed before giving the medication?
I just reviewed his white blood count, make sure that it was indeed high. I also checked his temperature, and again allergies if he had any.
Does this information affect your decision to administer the medication?
Yes, because if he had allergies, I obviously wouldn't give the medication, and if his white blood cell count wasn't elevated, I wouldn't give it.
Okay. Does this information affect how you administer the medication?
No.
Okay.
Okay.
All right.
All right. So let me just, no problem. Just finish documenting. I'm doing 125 milliliters over 1 hour here, and IV set at the right. Oh, piggy that.
Alright.
Okay, now just put my initials. Okay. All right, now we're almost done, Mr. Estivo. Okay, so I'm just gonna ask you, what side effects would you have if you were having any kind of adverse reactions for lisinopril?
Dry cough and I don't know,
Headache.
headache.
Okay. And what would you be having with your insulin?
Insulin, hypoglycemia,
Perfect.
confusion.
And the last one with the vancomycin?
I'm sorry, what did you say?
The
Oh, I
vancomycin?
couldn't hear you because it might be.
You're so funny.
Hearing
Yeah.
loss or maybe red man syndrome.
Yes.
Red.
Perfect. That was great. Well, I'm also going to give you these pamphlets on foot care and all the medications that I gave to you today so you can do some studying because I also want you to take these good habits when you go home, okay? I like you, but not that much enough to see you every day.
Okay, thank you.
All right, there you go. Do you have any other questions for me?
No, I don't think so.
No? Do you have your call light?
I do, it's right here.
Oh, okay, perfect. So remember, if you have to go to the bathroom or anything, just call me before you get up, okay?
Okay, I will.
All right, perfect. Just review again if you have any other questions or if something looks funny to you, on the medication, because it is also up to us to stop any medication if it's not correct.
Okay.
So if you have any questions, just call the pharmacy. Make sure you do your calculations because you don't want to ever have any med errors.
Okay. Good to know.
Okay, is there anything else?
Thank you. No.
Okay, I'm going to wash my hands. Thank you so much, Mr. Estivo. You have been a gentleman.
Thank you.
Thank you. Thank you.
Low blood sugar, right?